Hello everyone, my name is Sadia Akhtar. I'm one of two general dentists here in Aiken, South Carolina at Dental Center West. Welcome to Transformative Smiles. Transformative Smiles is a dental series we have made to share with you some clinical cases from our dental practice so that you can see how smiles can be created with modern dentistry. For today's case, I'd like to share with you one of my partial mouth rehab cases. This is a patient who came in to see me for inadequate tooth display, which means that when he smiled, he really showed very little to no tooth structure. He found us in our office at Dental Center West in Aiken, South Carolina, pretty much through word of mouth, and he made a consultation appointment to discover what can be done. So what we can see here is that this patient had some wear of his teeth. His teeth were also in a less than ideal position, which resulted in him showing no tooth structure when he smiled. This was the main issue that he wanted addressed, and he wanted to accomplish this without having to do any braces or orthodontics. Generally speaking, the issue with wear is that it can be self-perpetuating. What this means is that as time goes on and you wear through the more protective layer of your tooth, the enamel, the softer layer of tooth becomes exposed, and this is called the dentin. Dentin wears at a much greater rate than enamel, so after a certain point, the wear on your teeth can accelerate at a more rapid rate. If it's caught early on, the treatment involved can be more conservative, but once there are changes to the bite as a result of the wear, or if the tooth position is not in an ideal position, then a partial or a full mouth rehab can become necessary. So with this patient, his original bite did not have teeth in an ideal position to protect his front teeth from premature chipping. And you can see some evidence of wear and chipping on his central incisor, some of his laterals, and cuspid incisors, cuspids as well. Since orthodontics was something that was ruled out by him, he needed a partial mouth rehab in order to redesign his bite, as well as lengthen his teeth. So here's what we were able to do for him. These are porcelain zirconia restorations, which are made custom by the laboratory. When you look at his crowns, we make them appear as lifelike as possible. The lab ensures that the teeth are the appropriate shade, shape, and contour for our aesthetic and for our functional design. This next photo is what he looked like before having any work done when he smiled. He really showed no teeth on top, or really many of his lower teeth didn't show either. And this is his after photo. As you can see, he definitely shows more tooth or has more tooth display when he smiles now. The process of getting to this end result involves testing out the new proposed bite in what are called provisional crowns. Provisional crowns are temporary crowns, which are made of acrylic that can be easily changed. Both the patient and I were able to make sure that we were happy with his tooth display and his bite even before the lab fabricated restorations were made. This testing phase went well and we were able to proceed. So this is an example of a really transformative case which demonstrates what we can do to help our patients either with tooth wear or for patients who have teeth in a less than ideal position. If you are a patient looking for this kind of dentistry in or around the Aiken area, I would encourage you to take a look at our practice website. We are a team of two general dentists, Dr. Asbel and myself, and a periodontal specialist. Give us a call to schedule a consultation to see how we can help you. Thank you for joining me, and remember that your smile really impacts your quality of life in so many different ways. You absolutely deserve this type of dentistry because it is an investment that has the power to transform your future.